and it will be available after the call on Sage's website, and we will make sure this gets distributed as well to attendees. So again, thank you for joining. I'm excited to introduce our panelists today. With us, we have Lieutenant Commander Israel Cross of the United States Public Health Service Commissioned Corps. We have Kat Hutton, who is the Program Director of MiGen in Michigan. And we have Wilfred Labiosa, Executive Director of Waves Ahead in Puerto Rico. I am going to have each of them introduce themselves and give a quick little introduction, and then we'll go ahead with questions. Israel, would you like to kick us off?
Sure. Thank you. Lieutenant Commander Israel Cross, bringing greetings from an abnormally warm Baltimore, Maryland. I'm a public health gerontologist by trade, so um, I've been studying aging for the past 20 years, and now I do some work at the Health Resources and Services Administration at HRSA, really strengthening um, the health centers, all the safety net, underserved, medically vulnerable populations, which are absolutely critical to the healthcare system. So, yeah, in a nutshell, just aging and studying populations that uh, might be more at risk than others. So, so glad to be here. Thank you, Jane. Oh, you're on mute, Jane. There you go.
Thanks so much. Thanks, Israel. Kat, would you like to introduce yourself?
Yes, thank you. Hi, my name is Kat Hutton. I use they, them pronouns. I am the program director for MiGen, Michigan's LGBTQ plus Elders Network. We are a Sage collab partner, former affiliate. And I came to this work. My dad was actually a nursing home administrator, so I think I've been working in the geriatric field since the second I was born, as a volunteer, I suppose you could say. And I am a master's level clinical social worker with a focus in geriatrics. And I'm very excited to talk about the work we've been doing in this in the public health sector in general is something really important to our community and to making sure that everyone is getting the services and access that they need. So thank you for inviting me to be part of this panel. Excited to participate.
Thanks, Kat. Wilfred.
Saludos. This is Wilfred Labiosa, and I'm the Executive Director of Waves Ahead, the organization here in Puerto Rico that provides direct services focused on the LGBT older adult. We have 5 community centers across the island and the one in the capital, which is San Juan, where I am connecting today. We also have supportive housing units and also independent living units that are beginning in 2025, focused on the LGBT older adult in 3 locales in Puerto Rico. So looking forward to the conversation and really thank you for the invitation and for including our voices.
Thank you all so much. Really appreciate it. We're going to start the conversation today with Israel Cross. I have a few questions for Israel, and then Kat and Wilfred will come back to talk about the work they have done on vaccination efforts with our LGBTQ plus older adults. Firstly, Israel, I would love to know what risk less, do more means to you in terms of vaccinations.
Yeah, I guess without trying to say the words word for word, but risk less, do more is exactly what public health's all about. I stand here as a public health service officer, but also representing the Department of Health and Human Services. And getting my fall vaccines isn't just about prevention; it's about protection. Uh, in the expression, sort of, kind of, let me live my best life. So. It's about taking less time worrying about infections, exposures as much, and just, being able to enjoy what matters, which is, family and friends to me, especially with respiratory season already in effect and the holidays around the corner. It's about community and immunity. So it's about mitigating risk so I can do more and be more for my family and friends.
Awesome. Thanks so much for that answer. Talk to me a little bit about what the Department of Health and Human Services does to increase vaccination efforts and numbers across the United States.
Yeah, so we launched the Risk Less, Do More campaign in August of this year. It's a newer campaign to help folks stay healthy. Again, like I said, during respiratory virus season. So it's HHS is doing a lot to make it easier to get your flu, COVID-19, RSV shots, sharing clear, trustworthy vaccine information. We know there's a lot out there on what they call it X now, Twitter, and other social media platforms, but we really want to make sure we share trustworthy vaccine information and also helping you get vaccinated. So it's meeting people where they are, so people can go find out where they can get vaccinated, and also building confidence in the vaccine safety and effectiveness. Some other things are, HHS is working really hard to reach the folks who are at a higher risk for serious illness, and we're talking about, older adults, 65 and up, people living in long-term care facilities, those with underlying and comorbid health conditions, pregnant people, rural communities, people with fewer healthcare options, and even down to, intersectionality and racial groups, so Black and Hispanic communities who face higher health risks. So again, the best part I think about this campaign is um, we're bringing the vaccines to where people already are. We've teamed up with over 50 organizations, um, hosting events at sports games, music festivals, cultural celebrations, community gatherings. And again, like I said earlier, it's about community, immunity. So far, there's been over 60 events and 60 pop-up vaccine clinics and communities. So again, Department of Health and Human Services is meeting people where they are.
Awesome. Thank you so much for that, Israel. I love that kind of motto of meeting folks where they are and 60 events. That's amazing. Talk to me a little bit about some of the challenges in doing this work. What are the challenges in meeting folks where they are?
Um, I think I think some of the challenges are the health misinformation. Um, and sometimes we see that a lot has happened, especially since COVID, and people are kind of like, yeah, we realize you might be in close proximity to a vaccination clinic, but I heard so much about the vaccine, and I don't know if I can trust it. But again, that's one thing that the HHS campaign is doing a lot about, which is, ensuring people are taking care of themselves and their communities. So I would say health misinformation is one of the main challenges. But again, all science-based. It's not our carte blanche. Everybody just go get vaccinated without providing any factual information on the website. So also, talking to friends and family about the impact of misinformation, um, really giving people a reason to pause and really think about all the things they've heard, uh, may have seen online, and things that they share. So again, the way we're meeting that challenge is, uh, spending dollars on paid TV ads, radio, print, social media, digital ads, even getting news coverage on the benefits of being vaccinated. So, even though we're meeting people where they are, we're making sure that we're providing education, easier access, and, a reason for people to give a little pause to, maybe some things they may have heard that might not be correct.
Absolutely. Getting the correct information out there is so important. Talk to me about how you have seen the conversation around vaccines change between, we had pre-COVID when folks were getting flu shots and We hadn't really seen RSV shots come on our vaccinations come on the scene yet. And now then COVID happened, and that brought a wave of people, interested in getting vaccines. And now t talk to us about where we're at in 2024 and how you have seen things change.
Um, I would say before COVID, um, a lot of people were, you know, making sure their children got vaccinated as part of their like preventative health care. There was some hesitation about certain vaccines. I'd also say kind of the general sense about flu was that it's really not that big a deal. I think, when people would see people wear masks in public, uh, people would be like, man, what are they doing? And now it's pretty common and no one thinks twice about it. But I think when the pandemic hit and, a lot of people were dying every day, I think there was less resistance to vaccines, but also, of course, the voices got louder about, who were anti-vaccines. But as newer and maybe milder variants started to emerge, and vaccines started to be updated, some people started being more skeptical about, how well do these vaccines really work, and do I really need this? And I'm here today to remind you that um, people who hesitate to get vaccine for flu or COVID continue to be hospitalized at a higher rate than their counterparts who don't get vaccinated, especially when you consider people at greater risk for severe illness or hospitalization, like our older adults or and now the population. So just for last year, and for an example, almost a million, so 900,000 and change people had to be hospitalized for COVID, and nearly 9 out of 10 of them were not up to date on their COVID vaccines. Um, Even though it doesn't happen as frequently as maybe it used to, or in the media, people still get hospitalized for flu. People still die from flu complications, especially those who have underlying conditions. So, I go with these public health and education campaigns to make sure people understand how the vaccines work. Um, Really just highlight how they've been tested, monitored, how they benefit us, and those things that maybe we didn't look at as a problem still persist, like flu. So yeah, just continue to get the word out and just kind of be a bright spot in the communities.
Absolutely. A theme I'm hearing is, again, taking care of yourself to take care of the community, right? This is a group effort. And I think we saw a lot of that during the pandemic. I think there was a lot of messaging around, do this for us, do this for everybody, do this for the folks who are, immunocompromised, or the folks who
Yes.
might not have the same health level as you do, right? So really saw a lot of that community.
Yeah, it's like that, when you get on the airplane and they're like, put on your oxygen mask first before you can help anybody else. So, it's like I'm not putting myself at that risk if I can get vaccinated. And again, then you're also helping your community too. So, yeah, great point.
Yeah, absolutely. You've talked a little bit about, inclusivity in this campaign. Can you share how folks can be inclusive in the ways they approach vaccination promotion as it relates to intersectionality?
Yeah, I think leaders have to stand up in their own communities. We're seeing more and more research about um, and then this is particularly referencing, maternal child health research, but it's also the case for other research is when people look like them and are educating people like them, people tend to do better and better have better health outcomes. So, you talk about people who speak their language, people who share their same experiences, um, culture, heritage. That all really does matter. And it's critical that, you have trusted messengers from all communities and making sure they're engaged, consulted, and equipped so that you can help people understand, why things like vaccines are important. And, answer the questions people have. Because sometimes, Jane, having more trust in people than uh, trust you'll find online or any other sources. So, that good friend or loved one you might have, it may be called to lean on you one day. And it's about having people that, look like us. So it's being inclusive is more than just a good idea. It's absolutely necessary. Even though we've made some progress, I don't think we've achieved, of course, true health equity in this country. So it's a long way to go, but it can start with us. Everybody standing up. Webinars just like this can be hugely tremendous. And, for the people logged on, they might go out there and maybe one person asks them in the next month or so, but that's one more person than it could have been. So it's not possible to improve the nation's health if we're just focusing on a part of the nation's people. So this is why inclusivity matters, intersectionality, having people that look like us and represent us, be able to stand on things like this. So yeah, it's we got to stand up.
Absolutely. Thank you so much, Israel. I appreciate that. That's a great segue into bringing Kat and Wilfred back to talk about the work they have done in community. I just want to say again, thank you, Israel. That was such an important conversation. And if you have anything to chime in, during the next part of the conversation, please feel free to do so. Before we move into this section, I just want to remind folks that the Q&A is open, so please feel free if you have any questions throughout this webinar to please drop your Q&A in that space or in the chat, and we will happily answer any questions you have. As we chat with Kat and Wilfred, we'll learn more about their work specifically in increasing vaccination efforts among LGBTQ plus older adults. So if you have any questions about implementing any of this work in your own community, please feel free to drop that in the chat. Welcome back. Thank you both for joining us. Our first question, and I will start with Kat and then Wilfred can answer second. But Kat, talk to me about why your organization originally got involved in promoting vaccination efforts.
Yeah, so at the time at our organization, it was really a point of kind of transformation in what we were doing. And this was really our first time getting into kind of public health work. And we saw this as just a tremendous need in the community and a way that we were really able to increase our capacity to learn about public health messaging while also being able to aid all sorts of folks all over Michigan and getting access to these really important vaccines. We knew that for so many of our folks, they were very, very isolated during the pandemic, that they were really struggling even more than they already were. And so we saw it as just imperative that we had to figure out how we could assist and aid in that, in getting people back together and getting people connected, and doing so safely. So that is how we got connected. We are working with NCOA, National Council on Aging, and the CDC in terms of funding for the efforts, which were really great partners in being able to get really good information to be able to pass on to our community.
Thank you, Kat. Wilfred, talk to me about Waves Ahead and why your organization decided to get involved with vaccination efforts.
Sure. Well, we had already ongoing efforts in regards to the influenza shot that we always gave and provided during the fall season for all of our participants and community members that are affiliated to Waves Ahead in our 5 community centers. And so when COVID began, and even now, we saw the need for us to be able to provide the vaccination to our clients, because the clients and participants, first of all, didn't have accessibility to the many sites that the government was providing to give the shot. And so it was important for us, for them not to be, receive a lot of the LGBT phobia that is still in existence here in Puerto Rico and around the world, but in regards to Waves Ahead here in Puerto Rico. And so they were not feeling comfortable going to the many sites if they were able to reach the site to receive the vaccination. And second of all, the approval process for them was coming negative, meaning many of them were not being approved. And so we saw there was a need for us to be able to provide free and confidential vaccination clinics all across the island, including in community settings. So although we have 5 community centers in the 4 cardinal points of Puerto Rico, and in the capital, we saw that there was a need to also bring that mobile vaccination clinics to the community at large. So then they and us, we could speak the same language. They would feel comfortable with us, and we would be able to provide the vaccination.
Great. Thank you both so much. I'm hearing a theme of access, right? Making sure that our folks and our most vulnerable folks have access to these vaccinations, right? So awesome. Great work. Kat, talk to me about some of your efforts to increase vaccination and part of the campaign. Tell me about what that was all about.
Yeah, so we really approached the campaign. For clarity, we are not vaccine providers ourselves. We worked really in partnership with vaccine providers around the state in terms of being able to promote vaccination and working with those partners to provide the vaccines. And when we were thinking about it, we were thinking a lot about how to excite people about it. We were seeing a lot of things targeted towards older adults that were all very scary and were very about like, do this or you're all gonna die. And while that was maybe effective at a certain point in time, it quickly lost appeal to many folks and also was focusing on the distress. And we really wanted to focus on the togetherness. So kind of this risk more, or not risk more, risk less, do more sensibility of we wanted to talk about how being vaccinated allowed you to be together. And so we started doing these really cheeky campaigns. So we had a whole campaign called the hottest bodies at the beach are vaccinated. We did another vaccine, or we did a senior fashion show that had vaccines available at it with local community members. We were really focusing on trying to show that getting vaccinated allows you to be together, allows you to have fun, that it's a positive thing, and that we really kind of similar to what Wilfred was saying, focus on bringing the vaccines to where people were too. So people weren't getting excited about setting up a vaccine appointment, but they were excited about going to a fashion show, and we gave out every vaccine we brought when we were there. No one really signed up ahead of time, but once they were there and they were available, people were willing to get them. And so we really realized that we needed to focus mostly on the social element, that people, that's what people were craving, and that the health wasn't always triggering for people as a need, but once it was there, most people were willing to get it if it was easy, accessible, and paired with something fun. And then it kind of brought it to, we are trying to almost like trigger a new pathway in your brain. Don't just think of it as fear, but also think of it as this togetherness. We did a lot of research showing research into, especially later in the pandemic, into how LGBT folks were reacting to the pandemic. And we found that a lot more people in the LGBT community, rather than, the general community at large, found it to be like something that we did to protect each other. And so that's what we were really focusing on, is like, this is something we're doing for each other to connect, to be part of community. And so that was really where our focus was on in our campaign. And it was honestly a lot of fun seeing people's reactions. We're at tabling events and people look down and they see an 83-year-old in a, in beachwear. People would look at it and talk. It allowed us to have points where we could start a conversation where, a lot of times if we just brought up vaccination alone, that vaccine fatigue, people didn't want to talk to us about it. But when it was paired with something funny or fun or a social event, people were a lot more open. So that's where we put a lot of our focus.
I love how strategic you had to be and how creative that allowed you to be in that campaign. Wilfred, what about Waves Ahead? What are some of your campaign strategies?
So we were hearing from the Department of Health that not too many LGBT people were being vaccinated. And they continue saying, well, you don't want to get vaccinated. And I was always responding to them saying, there's so much misinformation out there that we needed to counteract that with the correct information or with a more appropriate information. So we decided a ways ahead to do listening sessions among community individuals that were really believing that misinformation. And we used them as the spokesperson with the information that they learned from us. And so we started to use the same voices that were doing the voices negative in the communities to really jeopardize vaccinations for them to be the ones who learned about it, and that they were going to be our voices of ways ahead. Of course, we have other peer leaders and community members that were part of Ways Ahead, and they continue, educating at large the community. But really, we wanted to use this as a way to prevent further issues with our elders. And so we really started to try to take away that noise of the misinformation and really focus on a preventive aspect of it, because they already know about prevention because of HIV, because of diabetes, because of so many other diseases. And so we really wanted to speak their language by not only translating everything that we were gathering from the United States into Spanish, but also do it in a slang in Spanish that would be useful for them. And we also understood that many times they don't do internet, they don't have access to these social media. And so we needed to also publish in the newspapers, be also in the AM radio stations that are heard all across the island, and be able to do PSAs, be also to participate in many programs to really be able to outreach to them in a wide array of topics, all focused on the prevention and the use of vaccinations. And so we really tried to do multifaceted approach, and it seemed like it worked because now people look at us, even though we don't look for us, even though we don't advertise our vaccination efforts that much anymore, they still come to our sites asking, when is our next vaccination efforts that you're hosting? And so it really worked. And then we continue having the AM radio. We also do a lot of posters on local pharmacies that continue advertising that. Something that we learned is that in the United States, many of our colleague organizations don't use this type of grassroots education that much, but we do, and it still works for us.
For sure. It sounds like you, again, had to be strategic and also focus a little bit on both, right? Focus on accessibility, but also focus on getting correct information out to folks and making sure folks could build trust with you, which it sounds like you did. So awesome. That's wonderful. Kat, talk to me a little bit about some of the challenges that you and your organization faced during this.
Yeah, a lot of it was access. Especially, once the state of emergency ended and access to vaccines became just just dwindled tremendously. But even during that time period, it was, access was not the same everywhere. So we are a statewide organization, but for in-person services, we cover 4 counties. And I saw, for example, a huge difference in accessibility for, say, the city of Detroit versus the white suburbs. That it was really, really easy to get, Oakland County Health Department out there, but the Wayne County one was much more challenging. So in areas where we were seeing that folks who we know are the most disadvantaged in terms of access, we were seeing that ourselves, that even as community partners, it was really hard. So we had to get really creative and work really closely with community partners, with home care agencies, with student, like with smaller, local health providers and things, to work really creatively and bring vaccines to where people were, and to figure out how to get them there. Same with, for folks who are homebound, that again, certain areas were easier than others to get people access into those. Um, Another thing too, like kind of what Wilford was saying, was the misinformation was a huge barrier, that not only trying to correct people's misinformation, but also just accessing the correct information ourselves at times. There were times even working with the CDC that we'd ask questions and it'd be like, well, we're not quite sure, especially early on when no one really knew what was going on. And so, being able to learn new information, relay that new information, undo any misinformation that might have happened in the past. All of those were really challenging. But I would say by and large, just literally having access. I mean, there were times we would be calling doctors' offices and they'd say, yeah, we ordered the vaccine 2 months ago. We still haven't received it yet. And so that's the kind of barriers we were working with. And so trying to figure out how do we mitigate harm in the meantime? How do we make sure people have access to testing kits? How do we make sure people have access to, PPE? How do we make sure that they know how to protect themselves? They have hand sanitizers, all these other things that they need while they're waiting for vaccine access. And so having to think really creatively about all of that work too. And then simultaneously, how do we keep being engaged with these folks who are waiting, who are waiting, and make sure that they still know that we're thinking about them, that we're working on it, even if we were having trouble finding a vaccine in that moment, making sure that we stayed on and made sure that they eventually received it, even if we had to wait longer than we would have liked. Um, I see Wilfred nodding, so I can only imagine that was even worse in your area. That the access, I can only imagine. But yeah, it was quite challenging and still is.
Thank you so much, Wilfred. I'd love to hear from you.
So ditto to everything that Kat said. Plus, so I'm not going to repeat that. Plus, one thing that I think Kat will agree with me is funding. After the big first years, even now, we do have some funding that we still continue providing the new vaccinations related to COVID and to influenza, but that has been a challenge and continues to be a challenge. And the last thing for us as a challenge is about refrigeration. Puerto Rico, I don't know if too many of you have been to Puerto Rico, but we are an island in the Caribbean. And so the warmth here is sometimes gets excruciating. So a lot of the times these coolers that we take to the vaccination efforts really are not enough for so much time. And so we have had, and if you're asking, well, there's electricity. Well, no. So many parts of the island, we lose electricity at any moment. And so that it is an issue for us that we cannot count with the refrigerators of our mobile vans, of the homes or the centers that we go to, because they might just fizzle away. And so we cannot use all the energy of the vans because we still need it to run all the other medical services that we provide in the medical vans. And so those two for us have been a challenge and continue to be a challenge. We have addressed them, of course, but it still is a problem.
Thank you so much for sharing. I really appreciate that. And I think it highlights, again, that prevention is more than just the vaccination part too, but prevention is, again, like Kat said, and like you said, but making sure folks have access to testing, making sure folks have access to PPE. And I just really appreciate that. Kat, did you have anything else to add? I saw you go off mute.
Oh, I was just gonna say about the funding. Additionally, like not just the funding definitely dried up, but even when the funding was really robust, a lot of times the funding streams would allow you to fund for outreach or for incentives, but not for the vaccines themselves. And so a lot of times it was like, cool, we would have this if we could just have money to pay for these vaccines, but that was so frequently not allowed by the major existing funding streams for this kind of work. So it's just thinking about those kinds of things too when we are getting funding or these organizations. How are we allowed to use it, and can we actually utilize it for the thing that we most need? And that's not always the case. So having to get really creative there too.
And we also need to continue being creative now because it's not in the radar of so many people now, because it's not talked about. And of course, this is a year of elections. We just had a major election. And so people were focusing on that, but not on their health. And so that's why it's so important to continue bringing those messages, because we are failed too. We fail because we also get engaged with the politics and forget about, the other components. And it's so easy to do. It was so easy to do this year. And so we really continue having in our calendar that we continue promoting messages in our media, in our PSAs. We update those. We provide articles to the newspaper so they can run it for free, and so we continue trying to educate the community, although they don't want to talk about that anymore because it's no longer in existence.
Right. That's a really great point. I mean, we're still seeing what they were calling super spreader events, right? We're still seeing a lot of that. We're still seeing music festivals and then hearing, X amount of people that attended this ended up getting COVID or XYZ. So I think it's really important that we continue to have these conversations, right? And continue to, um, again, get vaccinated, make sure that we are testing ourselves if we're going into some of these really big spaces. So thank you. Great, great
And
point.
the kids, the testing kits, I'm not sure, Kat, about your night of your area, but for us, it's very limited access to the kits, and they have increased in price. So
Yep.
for us, we were getting them for free, and then now we don't. We have to pay a certain fee, and then certain insurance companies don't include it or include it. And so we get donors that give it to us, say, hey, I cannot give you money, but I have access to kits. And so we get them, but their storage life is so short now that, we tend to start throwing them out because people don't want them. Now, all the staff has so many kits that we test ourselves like a little bit too much, but it is because, as you say, Jane, we attend all of these events, doing outreach, doing educational, and we are even afraid for ourselves, so.
Absolutely. No, that's a really great point. I'd love to hear from both of you. What are some success stories? Have you seen anything firsthand? What are some of the successes of your work that you accomplished?
Yeah, so it's funny. I always have a hard time talking about my own successes. So like when I look at it, I all I can think about are these barriers, and so I appreciate you bringing the point to, hey, let's talk about successes too. One thing that I thought was really cool that we did is so like I mentioned, we had this fashion show, which I know sounds so silly. We had like the bartenders were dressed as nurses and like it was very fun. But in addition to that, we also did a photo shoot around the same time that we were using partially for the campaign ad. And in that, what we did was we trained all of the models who came to us and trained them in messaging and trained them in how to talk about this work. So they were models, but also became community advocates in that sense. And what was really exciting to me was that people were like the people who, once we asked them, hey, are you interested in engaging in this kind of work? People who hadn't even thought of it, who might not have volunteered if I just posted a posting and said, hey, come get trained for this, but people who were already willing to come in to be a model, once I asked them, hey, are you willing to learn and listen and be an advocate? Not only were they willing, but they were really excited about it. And they had all these ideas and they were bringing things to the table that we wouldn't necessarily have thought of and reaching people that we would never reach. And so that was really exciting. And then also being able to pair the work we were doing with our community navigation work. So, focusing on people who might not have reached out to us for a vaccine. Maybe they reached out to us because they needed food. Okay, well, we helped them with food. Now you trust us a bit more. Now that we talked to you about vaccination, you might be willing to listen where maybe you weren't before. And we found that a lot of, I think Wilford was saying this earlier, building that trust is so important. And that is really where most of the successes came from, right? Was helping someone with something that's really meaningful to them. And that allows them to have a more open ear to listen and to consider things like vaccination, to consider things like new information. And so that was really where a lot of our successes were on that kind of one-to-one interpersonal level. And then these like big, fun, silly events that just caught people's eye and made people start thinking.
Thanks, Kat.
So for us, our successes, there is a benefit to everything, to our madness. It is predominantly, we did increase vaccination among LGBT elders and among LGBT community at large across all of our sites and around all of our activities. And really, they had fun during the activities. It's not only about receiving your vaccination, but in many instances, they received raffles. They participated in social activities that were there, support groups that were held around the site where the vaccination effort. So they really engaged, and they are still engaged with us to the point that we also saw an increase of utilization of our mental health services that we provide from our centers into our support groups that we give and we provide, as well as the yoga and meditation sessions. So we used it as a way to also educate them about all the different services that we provide from our sites. Some of our services are hybrid, meaning that it might be out of one site, but you can connect from abroad, from any other place around Puerto Rico. And other are physical, right there, in-person events, and they are coming and they're driving, or they're getting their friends to drive them. And so we really saw an increase of that. Also, better, and now they know that something is false news. Sometimes they see me and they say, look, I caught this picture. This is false news, isn't it? And sometimes it's real, because of the election, what happened. But having said that, is many times they can capture what is false. And now they have that tool to be able to recognize what is true and what is not. And if they have a question, they feel free to call us. They answer, they ask the question, we answer them. And so that way there is a communication between all the potential clients, all the ones who have participated, and the ones who are coming on a daily basis to our sites.
Congratulations to both of you. It sounds like you both had, amazing successes. And again, you really built trust with the community, which then in turn translates to people utilizing your services. People, like you said, Wilfred, knowing that you've offered vaccines in the past and calling and asking, when are you doing this again? So just, kudos to both of you and your organizations for doing important work. I'm curious, what advice do you have for folks wanting to do similar work, whether that's prevention or vaccination efforts? What advice do you have for those folks?
I think my biggest piece of advice is just to really rely on your community networks, by which I mean, we would not have been able to do any of what we did if we weren't really working really closely with our community partners. So that would be pharmacies and health departments, but also community centers, or just finding out who's at the top of these phone trees. Like when I talk to a lot of folks and I ask them, how do you get, talk to your participants, ask them how they get their information. When I was asking people, a lot of people told us they still basically it's a phone tree. Someone calls someone else who tells someone else who tells someone else. So figuring out who's on the top of those, really getting to know your community, figuring out like a community messenger, yeah, it might be like a local celebrity, but it also might just be that person who goes to the event first and tells everyone else how it was, and so realizing that the folks who do show up are usually connectors, that they are usually people who know people, and not being afraid to ask people like, hey, I know you know all these people. Would you be willing to be a messenger for us? And really thinking strategically in that way. Because I think that so much of what we do at the end of the day, it really just depends on if you have good people working with you to help you accomplish those goals. Because when these things like access issues are coming up, or transportation, which I know is a huge problem in Michigan, I can only imagine it's a huge problem in Puerto Rico. Um, people that you can ask for help with, like that you can ask for their thoughts on, that they might have a different perspective that you didn't. But really getting to know your community, because what's going to work for one is not going to work for another. And really recognizing that, don't be afraid to ask. Don't be afraid to ask both your community, but also ask your partners for help, or work on it together, because everything we're doing is just going to be so much stronger if we're working together on it.
Once again, ditto to everything that Kat said. Plus, if you want to do it, just do it. I think we're so afraid of just doing a new initiative because we may not have enough clients. But you know what? If you impact someone's life, just one or two, just do it, because those two individuals need of you, need of your assistance, need really of vaccination education, or even prevention of some sort. I always have listening sessions with participants when I go visit the other sites, or even when I go to the clinical side, administration, and they're there sitting in the reception area. I say, hey, do you have a moment? They always want to talk. And so I always say, hey, I'm thinking about doing this. What do you think about that? And they tell you overspill of information that is so rich and so wealth of what is in the eyes in the community. They can tell you. And I have listened, and that's why our programs are successful, because I always listen to them. Sometimes, they go overboard about what they should be doing and what should we do. But, you can at least take something from them. and really be able to implement it.
Yeah, I saw something in the chat asking or kind of mentioning about trans folks and access for folks who are trans to affirming providers. And that's something that over like our vaccination efforts, again, what I was saying before was just asking people a lot of times revealed
Mhm.
so much information. So when I was working with our trans clients or my friends or my partner in my own house, just like asking like, where are you accessing healthcare? How is your experience? What is that like? Who else do you know? Like, do you mind asking them if I can have their phone number so I can talk to them and find out information? Because so much of this is really in like whisper networks. And the only way you're going to get connected to those is just simply showing that you're trustworthy and asking. So I've learned so much more about how people, like how my trans friends and my trans community members access, I mean, I'm non-binary myself, but how people access like who they're reaching out to, people who might not label themselves as trans friendly on their websites, but really are. And you're only going to find out that information if you're showing to be trustworthy and asking. And so just really again emphasizing don't be afraid to ask the people you're trying to help. I think a lot of times we try to ask everyone else but our community members. We'll be like reach out to these other organizations to say, "Hey, tell me this." But at the end of the day, ask the people you're assisting. They're going to tell you what they know and they're going to tell you what they've learned, who to avoid, but also who's great and who might not be advertising it. And that's really, really, really important work to be doing.
That's such a great point, Kat. I think LGBTQ plus people are really good at sharing information with one another. I think we're really good at, even if it's underground, having a secret network of ways to share information of, again, who is trustworthy? Which health centers did you have a good experience at? I think, again, we have had mistrust with health organizations in the past. And I think because of that, we're really in tune and we really connect with one another based on what works
Yeah.
and doesn't.
And I think being really honest with people when you're making referrals too, not over-promising. So like I'll tell people like, "Hey, I'm hearing from these folks that this is good. However, I've never actually like accessed it myself. I've never like experienced it directly. So you can make this decision and that's totally up to you, but I want you to have the information I have." And not being afraid to tell people like, "Hey, this might not be the best experience, but it will get you what you need. We can work with you. We can mitigate any potential harm. We can send someone with you. We can do all this." But not limiting resources available to people because you think it might, because you don't know for sure that it's going to be absolutely the most affirming. Let people make their own decisions. Let people have their autonomy. I've noticed that a lot of times when I work with folks, they might say like, "Oh, I don't know for sure if that person's affirming, so I'm not even going to tell someone about the resource." Well, still tell them. Just let them know the information you have or don't have. Like don't limit the options you're providing people, but let them know the risks or potential risks that they're heading into. Because ultimately people still need services, and if there's not a perfect one, how are we accessing the ones that do exist still?
Absolutely. Thank you, Kat. I really appreciate it. And thank you to all of you for, sharing your experiences, sharing the work that you've done. I really appreciate it and think that this was a very rich and important webinar. Israel, I would love to hear if you have anything else to add. I know there were a few questions in the Q&A that you answered, so thank you so much. Is there anything from that that you kind of want to highlight or reiterate?
Um, I think, this is I would say it's dynamic. It's there's always room for improvement. And although I'm representing HHS here, I think, you know, uh, I think somebody mentioned that the disability information and access line isn't really friendly to I think it was video relay services. So, getting feedback like this is important in order to make the process better. And Wilford's comment about Puerto Rico, I got a chance to visit there on a site visit to a health center. So, it's like when you have the opportunity to engage with people, it's a big difference. And, like Kat was saying, um, those underground channels, so to speak, um, yeah, they really matter when it comes to building trust. So I think that was all I would say. I really have appreciated this opportunity to share and really to learn and to hear about any challenges as well. So yeah, thank you so much, Jane.
Absolutely. Anything else that you, Kat, or Wilfred would like to share as well?
I think just kind of what Wilford was saying before, if just like if this is something you're interested in doing, like you can do it. Like even if you don't have a tremendous amount of funding, even if you don't have a tremendous amount of resources, there is something that you can do. It doesn't need to be all or nothing. If you can have one event where you're able to help people get vaccines, or if you can have one pamphlet developed that helps people, get correct information. If you have one volunteer who sends out reminders around November to say, hey, if you got vaccinated yet this season, just a reminder, like, anything you can do is going to be more helpful than nothing. So just remember that, like, I know we always feel the urge to have like the most impact, to have the most dramatic results that we can show to people, but at the end of the day, we're community helping community, right? Like that's what we're doing, that's what we're here for. It doesn't have to be complicated. You can make it really simple and people will be very grateful.
Yeah, that's great.
Wilfred, anything else that you'd like to leave the group with?
No, I think Kat just mentioned something. It triggered something. There's so much information out there already done in multiple languages. It's not only about English, and I know that, United States is such a conglomerate of so many different cultures and languages that, the health center, Kat, I invite you, if you have any individuals who speak Spanish and they need a connection, although they may never come to Puerto Rico, you can connect to us here in Puerto Rico. And we have so much services and information in Spanish that we can also give. And because of COVID, we can do this connection via platforms and phone calls and, so many different ways that the world is smaller in a sense because we can connect and we can provide each other services. About the trans piece, we had that recently that there was an individual living in Puerto Rico who had her heritage from Mexico, but she was born and raised in Puerto Rico. She's transgender, but she wanted to learn from someone in Mexico who was trans. She could never travel to Mexico because of funding, but we were able to connect her and she can receive counseling and therapy online. And then we can provide the medical services here in Puerto Rico. And, it has worked out, so you're not alone in this, not only as a provider, but as a participant or someone who's interested in getting vaccination. Maybe in your neighborhood they don't speak Spanish, but here we do. So it's not like I can invite you to come to Puerto Rico, but at least I could maybe do that service for you. I know Sage has a hotline that you can call and get some connection to services in Spanish and in other languages. So I invite you to call and to use the resources that are available in not only in English, but in Spanish.
Absolutely. That is such a great point, Wilfred, about accessibility, inclusivity, and again, really being intersectional in our efforts and making sure that we are including everyone in our efforts. So making sure that we have access to connections where we can connect folks to folks who might speak their preferred language is important. Um, Thank you all. Again, I am just so happy with this conversation and inspired by everyone's work and efforts. So thank you so much, Kat, Wilfred, and Israel. Um, I am going to make sure that the Q&A answers also go out with the recording as well, just so folks who didn't attend have an opportunity to see the questions that were asked and answered in the chat. I think there's some really good information here. But otherwise, I hope everyone has a wonderful rest of your day, a wonderful week. Go out and get vaccinated if you have not already, and spread the good word. Thank you all so much.
Thank you for having us.
Yes, thank you.
Take care, folks.